Greetings. I'm really pleased to be with Professor Pascal Alote, the Director of the World Health Organization, SRH, HRP, and also my good friend. My name is Professor Kihara Anne-Beatrice, the President of FIGO, and I really want to welcome all of you in this audience to this particular fireside chat. So please don't go anywhere. Stay on with us. We have a lot of issues to discuss. And I will start right from the top. We are in challenging and disruptive times. When we look back to COVID-19 and what it did to us globally, socioeconomic downturn, children were locked up. We observed a lot more teenage pregnancies, but as if that was not enough, we have been surrounded by climate change. I remember even in my country, we had drought, and at the same time, it had 2 episodes of locust infestations. Climate change has brought on food insecurity, malnutrition, humanitarian crisis. We have had a lot of wars and conflicts and changes in the geopolitical arena globally. I need not mention DRC, Israel, Gaza, Afghanistan. The list seems to be endless and very worrisome. We also have non-communicable diseases at epidemic proportions, and even communicable diseases, particularly in LMICs, still persistent and prevailing. I am a bit worried, Pascal. We have had efforts really put in to address maternal and perinatal morbidity and mortality. But looking at the SDGs, less than 6 years to go. And the fact that it is still looking like we're either plateauing and in some cases increasing. I don't know where we are going when I think of the SRHR agenda. And as if that's not even enough, backlash that is beginning to be experienced by us as we try to really forge and foster to saving more lives. Maybe, Pascal, as our partnership between WHO and FIGO, what makes this relationship even more valuable today?
Thank you, Anne. And first of all, can I say I am honored and delighted to have this conversation with you. Just to let you know, this is for the audience. I first met Anne at the PPH, the Postpartum Hemorrhage Summit in Dubai last year. And I was just totally blown away by the passion and heart and intellect. And it really is a true privilege for WHO through the Departments of Sexual and Reproductive Health and Research, SRH, HRP, and the maternal, newborn, and adolescent health departments for us to be deepening our relationship at this time for all of the reasons that you have very clearly articulated. Sexual and reproductive health and rights is under threat. I mean, it's not as if it's new. A lot of the threats specifically to the area are new. I think we just happen to have the perfect storm with all of the geopolitical issues that you have raised, all of the kind of the gut reactions to the COVID pandemic, and in spite of the rhetoric of solidarity, the real wave of nationalism and populism that we saw coming through. I think for us and for you and for this partnership, the really important message is that we still have a job to do, and we just have to forge on and do it together. So just to respond very directly to your question, though, WHO is responsible for providing leadership on global health matters, shaping the health research agenda, setting norms and standards, and articulating evidence-based policy options, providing technical support to countries, and monitoring and assessing our health trends. We develop evidence-based guidelines and protocols for prevention, diagnosis, treatment, and management. And these guidelines are used by countries to shape their national health policies and practices. And we also establish the technical standards for health interventions, medical devices, pharmaceuticals, and diagnostics, and so on, to ensure safety, quality, and efficacy. but we can't do this on our own. It's not possible. That is really not the way we do business. The guidelines are developed with the participation of external technical experts who constitute the impartial guidelines development group and external observers to the process and to represent different constituencies and stakeholders. So FIGO have long participated as observers to provide real-world feedback to these technical discussions, with particular focus to acceptability and feasibility of interventions in different clinical settings. And this context is absolutely critical towards promoting the dissemination and uptake of new recommendations amongst the members of FIGO. And we have to keep the viewpoint of FIGO members, the obstetricians and gynecologists who provide the hands-on care, in order to ensure that anything that we do is relevant. So this is the absolute bottom line. If we do nothing else, this relationship is absolutely key. And we welcome and value the WHO FIGO partnership. Most recently, we have together focused our attention on 3 particular areas: postpartum hemorrhage, which is where I met you. I really was blown away. I can't say that enough. Contraception and safe abortion care and access, and cervical cancer, HPV testing and vaccination. We rely on FIGO to disseminate and advocate for WHO recommendations to member societies, and to strengthen adoption of the WHO guidelines and best practices, and to advocate and provide training on WHO recommended interventions to enable implementation and scale up of our evidence-based practices.
Great. I will add a stanza or a line and say, we really as FIGO tend to be the guidelines to the bench and the bedside. And I really value our collaborative affiliation and the fact that you have had us for many, many years, non-state actor, in the abbeys or in the wings, but really bringing the practice, the priorities, our context as we see them, even from our nations, which vary very immensely. But I thank us because we have high-income countries, middle-income countries, low middle-income countries, and really low-income countries, all represented through the FIGO outfit. The science is there. And we have the scientific committees, where currently we have about maybe 225 volunteers providing their soundness in the different facets of the science. And I even recognize in WHO, the way you have divided the HRP similarly speaks to that symbiosis and synergies that we bring to the table. I will turn a little bit and ask another question. FIGO, WHO, we are now being challenged with the word decolonizing the space. What does this really mean to you? Because I also feel that a lot of people think of it like it's a historical, political arm to it. What really is it to this audience so that we can have an in-depth understanding together?
So I'm not going to launch into a lecture on decolonization, but absolutely bottom line is the idea that a lot of what we do in terms of the evidence and knowledge and so on is focused in a unidirectional way, and that there is expertise that is given to. I think what the whole issue around decolonization as it relates to the work that we do is recognizing and being very aware of this power imbalance, having a huge dose of humility to recognize that it is that we are nobody without the people that we work with, and that we need to find ways of breaking this down. If for nothing else, we're recognizing that we're getting nowhere with the approach that we're taking, and it is about a rebalancing of the power. Now, I'm relatively new to WHO, and I have to say I have been pleasantly surprised and particularly impressed with the engagement of non-state actors, in civil society participation in capacity building, patient education, implementation research, advocacy, and so on. I guess what I can genuinely say is that I have found WHO to be a learning organization, and the current leadership is clearly very committed to meeting countries where they are, and in efforts to understand context and work with different actors and capitalize and leverage what are very limited resources towards our shared goal of ensuring health for all. Now, it's not perfect, and there are lots of critics, but I would challenge anyone to say that there really has been no change. I think it's not going to happen overnight, but there is a very clear sense that things are changing. And after years of working together and having FIGO initially, and I'd mentioned as observers, we are, and this is why I say that things are changing. We are now at a stage where we are collaborating on developing guidance together. This is unprecedented. And it is on critical topics like postpartum hemorrhage in particular. It's the first time. This guideline is planned as a joint effort between FIGO, WHO, and the International Confederation of Midwives. And for the first time, WHO and professional organizations are working on this maternal health issue, and we will publish this guidance together with technical input from the members of these professional organizations, expanding the pool of experts representing low and middle income countries as well. So the whole process ensures that we can be inclusive without compromising on the quality and the rigor of the output. We have really exciting collaborations with, as I mentioned before, the International Confederation of Midwives, International Pediatrics Association, and of course with FIGO. And in-house, the Partnership for Maternal, Newborn and Child Health, the MNCH, and the Implementing Best Practices, the IBP network, also contribute to an extensive network on which we can draw for listening, for learning, for sharing and disseminating. And it's important that we look beyond maternal health as well in this particular endeavor. And so our FIGO collaboration also includes activities that are outside purely maternal health and PPH, as I've mentioned before, to also include contraception and fertility care. The chair of the FIGO Contraception Committee was involved in the Family Planning Accelerator Bottleneck Analysis, the BNA, which is a working group of WHO. And as a member, she reviewed core protocols and modules. She communicated back to inform the finalization of the tools and support to WHO to identify key stakeholders in the states where the analysis was going to be conducted. And this was also a joint effort with FP 2030. It also includes our work on the provision of safe abortion care, because the reach of FIGO amplifies the work of WHO. FIGO has helped with providing training on the WHO abortion care guidelines to member societies involved in advocating for safe abortion, Advocating for Safe Abortion project, which includes communities of practice across 30 African countries. And has been involved in virtual training with African Francophone societies and in person with African Anglophone societies, and follow-up support and guidance. FIGO's promotion of all of WHO's webinars and products have resulted in this information being communicated to 139 FIGO member societies, as well as social media followers and newsletter recipients. We work together on cervical cancer, which is one of the most preventable cancers affecting women, particularly, again, in low and middle income countries. And FIGO member societies are disseminating and training on WHO guidelines and screening and pre-cancer treatment. Your work is I could go on and on, but really, really totally appreciate that we wouldn't have half the impact that we have without this collaboration with you.
It sounds very exciting, and sometimes I even wonder, is that really us? But
it is you.
Here to say, our networks are our net worth. And I think really the collaborative spirit, and particularly reaching us to the last mile, I think really should be the essence of why we're talking about decolonizing. Everybody must have touch base. Primary health coverage, universal health coverage, the vulnerable and marginalized should not be excluded. And in fact, when I read more intently on the decolonizing agenda, it's really about equity. Equity. And just futures, the justice that relates to reproduction, the justice that relates to social justice, and I dare say even intergenerational.
Indeed.
Everybody needs to get a piece of that cake. And looking at the economics, the politics, the culture, the knowledge system, you've alluded to it. I was saying earlier on that even learning, how to use the computer differently for the learning management system of webinars, podcasts, and hybrid congresses, the list goes on and on. But I think it has catapulted both WHO and FIGO and other like-minded stakeholders to really have a relook at how do you disseminate to really get to the last mile. In addition to that, what kind of initiatives and programs are you actually setting up? I must be candid. For the longest, it was high-income countries moving southbound. But we're now even beginning to agitate. Should we really just always look in that direction? Or should we also begin to articulate South-South collaborations? You've alluded to what we're doing with Anglophone and Francophone Africa. And these are some of the reasons why we're moving in that particular direction. The other thing I want to speak to is our leadership. And the leadership looking at WHO and looking at FIGO, and what is really the theory of change in that space. So FIGO recently even started something we're calling Leadership Reach, the Leadership Development Initiative, and where you're removing barriers, having effective access and coverage, working very, very closely with ministries of health, not just at the policy level, but even at the programmatic level, but not overlooking that all we're doing is trying to give a better footstool for the patients coming to see us, and therefore highly engaging with CSOs and even directly with the communities. And I dare say, Pascal, one thing that I'm always very keen about is our accountability to those we serve. And Absolutely. I see that as the optimum for the decolonized agenda. Now, let me turn a little bit. SRH backlash, it's happening. I'll give an example. You had the Roe and Wade and how we had made gains with the abortion agenda. Then came the Dodds, and things have just gone down south. That's in high-income countries. But I sit in Africa and still have a lot of maternal mortality from unsafe abortions. Where should we really visualize ourselves going? In the face of the backlash, you talk about teenage pregnancies and the fact people still don't want us to talk about comprehensive sexual education, let alone safe sexual practices, let alone use of contraception amongst this age group. What and where should we visualize ourselves going moving forward?
Interesting question, and it is. I mean, we're having this conversation at a time when I'm feeling particularly bruised about the backlash against the agenda. As I say, it's not new. We are at a point where we perhaps we need to do a little bit more active listening as well.
Yeah.
I think there are a number of ways of tackling it. There is no point us doing more of the same, or amplifying and just saying what we continuously say louder in the expectation that there will be change. So I do think that as a way of moving forward, we do need to listen. And I think the running theme throughout this discussion is really about that, the equalizing the voices and addressing equity and justice and so on. So I do think, again, as I say, we also need a real dose of humility, recognizing that this notion of expertise might be useful in a particular sphere, but that sphere is not the only sphere of operation. We are working with people. We are accountable to people. So we have to open up and change the way that we do business. And we have to set in motion that process as much as possible. I mean, I think like just about every area of health, we often focus on the problems when things go wrong with our bodies. If we just focus on sexual and reproductive health, or that whole area, it is complicated by the fact that sexual health, the sexual health bit, let's put reproduction aside for a second, just the sexual health bit is fundamental to who we are. It starts with our bodies, how we define ourselves, how we interact with the world around us, with family, with friends, with intimate partnerships, how we fit into school, work, life, becoming productive in one way or another throughout our lives. It is how we define ourselves as people, fitting into a society. It's not about having sex. It's not about, and this is one of the issues that I think has been an important part of the backlash, that as soon as we focus on sexual health, there is this sense, even when we talk about the notion of body autonomy, that we are pushing a particular agenda, that I want autonomy so that I can go and
do whatever I want.
That is not what it is about. It is more than any other area about. And if we get the fundamental bits wrong cumulatively across the life course in terms of sexual health, if rights are not protected, if there are any violations, the effects are cumulative over time. And for this reason, we think it is really important to promote comprehensive sexual and reproductive health across the life course, not splitting it into, we're just looking at maternal mortality, or we're just, all of those issues are part of a cumulative life experience. And so we have to see these as an integrated package. So comprehensive sexual and reproductive health and rights are essential to achieving the right to health, and are a cornerstone for sustainable development, economic prosperity, and peace. And the sooner we begin to move outside of the kind of straight-jacketed way of thinking about disease and people and so on, the sooner we can actually begin to see how we can overcome some of these resistance issues and demystify what it is we are trying to work with people on in terms of proving health for all and enhancing access to health for all. So amidst multiple interlinked global crises, protecting and promoting comprehensive sexual and reproductive health and rights across the life course plays a crucial role in building population resistance at individual, community, subnational, and national levels. And even in the most challenging environments, governments can prioritize sexual and reproductive health because it is about people's lives. We're living beings, regardless of whatever else is happening around us. This is fundamental. It's absolutely the most fundamental, I would argue, in terms of the right to health. And in the ways that we promote rights and progressing steadily towards realization. And again, going back to FIGO, professional organizations working in sexual and reproductive health, specifically FIGO, have a critical role to play throughout the life of a woman, ensuring access to appropriate information and services at different points. We know that sometimes the only stable and consistent healthcare that a woman receives is through her obstetrician gynecologist. And therefore, obstetrician gynecologists have an enormous influence on the knowledge that any woman might have on sexual and reproductive health, her rights to autonomy, gender equality, as part of her access to universal health coverage. So ultimately, I think for me, in terms of this really rich opportunity now for us to really deepen the engagement with FIGO, is that as you're learning to overcome and work against or with or towards a stronger sexual and reproductive health and rights agenda, regardless of or against, however we end up working on this together. As you're learning, it's really critical that we engage with you and share that learning, because we all come at these issues from a different space.
Perspective.
Indeed. And it is, there's no single way of addressing it. We have to do this together.
Oh, great. Now, I'm hearing a lot of buzzwords, but I really want to pick you up on the Sustainable Development Goals. And really, I've categorized it into 4 or 5. People, the centrality of people, the planet we live in, and how do we secure that this planet continues to thrive? The other thing is peace and security, and we can see what's happening with the humanitarian crisis surrounding us. And partnerships, which we've alluded to at the beginning of this fireside. But I want to add one, the progeny, the offspring. And when I think through SDGs, I really see the centrality of women, children, adolescents. And that's where I really springboard with FIGO and tell them you are in a fountain where the woman placed at the center should really become the most prized person. If I was asked, Anne, where would you put your money? I would say the most important thing is investment in human capital, nothing else. And really, I feel it's a privilege that WHO, through your esteemed directorship at SRH and HRP and FIGO's work, can really resonate very well in addressing that return on investment portfolio. We have Mohammed Fatala, the late, who was a previous president in FIGO, who said this: we know why women are dying. We clearly know. We know what's the problem. But societies are yet to decide their lives are worth saving. And to me, it just sits with the magnanimity in my heart that there's so much we should be doing and so much more focus and empowerment on particularly women to make that difference. And to actually see, we shouldn't fragment that woman into little bits and pieces, because we tend to just see her as a reproductive being or her as a sexual being, but look at her in the holistic. Again, I keep on falling back to quotes from people. Educate a woman. You'll have educated not just the community, but a nation. And I'll even say beyond the nation, the globe. But is that really happening in reality? SDGs, I think, have been coined really to actually address the holistic approach and the multi-sectoral approach. In FIGO, we have those scientific committees, and I keep telling them, do not work autonomously. You are so interlinked. And this really brings on the issue of a multidisciplinary and a multi-sector approach. Actually, I'm telling people now, throw the box. WHO, FIGO must throw the box and not just think health. But as your theme resonated even in the World Health Assembly, all in health, all policies, regardless of wherever you are, should be speaking with heart, speaking to health. And again, it also said health in all. Nobody should ever be left behind. SDGs, very clear. So I'm really excited that it is at this time, despite all our headaches, we have to really come together and rally together to make it better. I will also move to something else, and you mentioned and touched on it, the issue of collaboration even with the International Pediatric Association, the International Confederation of Midwives. And I want to speak to the midwives, and even looking at currently where we are beyond the PMNCH is the fact that we're having a lot of people pushing for midwifery-led care, and ourselves who may even be resisting midwifery-led care. And maybe start off by saying a lot of the frontline provision of services is not by the gynecologist. The person who most patients first encounter will be now the community health promoter, followed by the midwife, and then it cascades upwards. What's really most important, if you ask me, is how can we synergize the agenda that speaks to the one common person, the human resource capital, with healthy women, healthy babies. Number two is how can we collaborate and have the continuity of care that you have alluded to, where the patient can even select, I want to be seen by a midwife. If there is a problem, then they can cascade it onto us. And have that continuum where we're moving from prevention into diagnostics, into curative, into rehabilitative, into palliation. So for me, I don't see the war, but I can see there are a lot of bad blood. I must mention this. And at the same time, people who are actually beginning to say, no, wait a minute, let's have a rethink. Which way should our health be going? And I really want to ask you, Pascal, you're in WHO. Is it now moving upstream to preventive and health promotion? Or is it still old school of curative medicine? Maybe you can answer that.
I think just again, just listening to you, everybody will agree with my statement in the beginning about your passion and your and how infectious it is actually.
Yeah.
In looking at this, in moving forward on this agenda. I also wanted to just make a comment on your interventions before, that I think for all of us, I think that the change, the sea change, is really recognizing that we have to come outside of our shells, of the way that we work. We can produce all of this evidence. We can have the right FIGO pipeline, and to get it to the ministries of health or to other practitioners and so on. But ultimately now, I think what is becoming very obvious is that we recognize that the work that we're doing is not landing in a vacuum. It is landing in a very complex world with people with real problems, and we can't continue to operate without engaging across sectors, as you say, without engaging with, at some level, small p for me in WHO politics, but for you and for our other partners. And this in fact reinforces again the reason that the non-state actors and formal partnerships are so important with WHO. In terms of the human capital question, I think this it's again a natural conversation that I should be talking to an OBGYN with myself as a midwife. Which great. So it is. Yes, we're walking the talk already.
Exactly.
Which is excellent. And then on the final piece, WHO has just, at the World Health Assembly, just had approved the new, effectively the strategy for WHO, which is GPW 14, translates to Global Program of Work, the 14th one so far. And in that process, again, for the first time, there was a global consultation on the development of GPW 14. I think the team that were responsible for drafting the document and actually bringing it all together, deserve a medal, because there were so many. It was the first time that WHO had really engaged in a very wide consultation to get inputs into the document. And that has now been approved by the World Health Assembly, which is the governing body, and we are going to move into the next phase of how to operationalize that and look at the indicators and so on. It is definitely not working to a standard kind of way of doing business, and it's working across protect, provide, promote, which ensures that we have all of we bring in the global health security agenda, and that we are much more prepared as a global community, that we strengthen our health systems in order to be able to deliver, and that we still have a very strong health promotion agenda as well. So all of this, I think, and all of this requires that even in the way that we do business internally, there is a much more integrated 3 levels of WHO. So it's not just what we do in, what's done in the payload corridors of Geneva. There is a really core, very strong mandate for what the HQ team does. Recognizing that at our regional offices and our country offices are where rubber hits the road, and that needs to be a much more seamless, stronger one, with the inputs of all our stakeholders, with the civil society or commission, again, a new body that's been formed, with our professional associations and so on, all come together. So it is, I think you will see that things are changing, that there is a real move for us to become much more relevant and much more responsive, and engage collectively in the leadership that that WHO is supposed to be providing towards health role.
Stal, I could continue listening to you the whole day, but as busy girls and ladies who are in leadership, give me your closing remarks. What do you reflect, even having spoken for the past, 1 hour? Yeah. What do you, if I was to throw you into a little bubble and say, Pascal, just give me one thing you want us to take home, or one intervention you'd want us to do. Or maybe let me make it 2. Make it 2.
I don't think I am very reluctant to be reductionist. But what I would like to really, I guess, emphasize is the importance of comprehensive sexual and reproductive health across the life course. That that we continue to see this as a critical issue to saving lives. It's not, we keep talking about the sensitivities, and it is about saving lives. It's about ensuring healthy lives. It's about recognizing that we can all fulfill our potential better if we are healthy, if we have access to the right sorts of information, if we have access to the services that we require, and so on. And we have to do this together. We have to strengthen partnerships. We have to build the coalitions that will allow us to do this. And we have to all work towards a world in which human rights are protected for all. And that we can all fulfill our potential as members of this human community that we all live in.
Great. I will add mine. I have 2 big ones. I have been grappling for a long while now, and also being in academia. Am I really generating health professionals that are fit for purpose? From the clarion call of the challenges and disruptors, and I believe they're going to continue. What can we do to reshape our curriculum, our knowledge, and our evidence synthesis so that we are relevant? And as we speak more and more to multi-sector engagement, maybe that's an area we need to really focus, the 2 of us. How do we make them fitting in and being able to actually provide services, knowing it's no longer just the mechanical, technical expertise, but there's a lot of global public health that now needs to be integrated into their learning system. The second one, and this one I must say, is to challenge the women professionals. You're a midwife, I'm a gynecologist. How many other women health professionals are there? But how many of us are stepping out and saying, I'm not just a health professional. I am a mother. I am a grandmother. I'm an auntie. I'm a cousin. I'm a niece, blah, blah, blah. Stepping out and saying, I know where the shoe bites most, and you're not going to keep me quiet. The voice and agency amongst women health professionals to become the leaders in leading the pack, that every woman, every child must receive quality care and be safe and be saved. And I believe the day we will all step out and stop shying off. I know I'm fighting a cultural norm, particularly where I come from and where you come from. But I honestly feel we can't be put a lid on anymore. Shout out. Let's really have this partnership going and our voices and agency heard all the more. I want to sincerely thank you for your time. And I really look forward maybe to another episode where we can dive a little bit deeper and really begin to dissect SRHR and where are we going with the backlash. Thank you so much. Highly appreciated. And all the best to my colleagues in Geneva as we continue this battle with trying to get SRHR at its best. Thank you.
Super. Thank you so much, Anne. It's been a real privilege. Thank you.
Thank you. Thank you very much.